Great, so it looks like it's 12:01. So hello and welcome everyone. Thank you for joining us. Thank you for joining the Preventing Type 2 Diabetes webinar. My name is Brad Lang. I'm the Program Manager for the Canadian Diabetes Prevention Program. This webinar will provide an introduction to knowledge, tools, and techniques for preventing type 2 diabetes. We'll also provide an overview of the Canadian Diabetes Prevention Program, or we call it the CDPP for short. The program is a 12-month program provided at no cost to people with type 2 diabetes or for people with pre-diabetes. And as its name says, its goal is to help people prevent type 2 diabetes. So the presentation will be about 20 minutes with questions and answers at the end. Feel free to submit any questions with the Q&A button at any time. The buttons should be at the bottom of your screen. And then at 12:30, the presentation will follow in French. So next up, I'd like to introduce both Alexandra Margina and Jennifer Chang, two of our program's health coaches. Now we'll hand it right over to Jennifer.
Thanks so much, Brad. It's a pleasure to be here with everyone today to speak about our program and how to prevent type 2 diabetes. So since we're a little short on time, let's dive right into the agenda for today. We'll start off with a quick activity to test your diabetes knowledge and then an overview of type 2 diabetes in Canada. From there, we'll talk about pre-diabetes and why type 2 is only the tip of the iceberg. From there, we'll also talk about how diabetes affects us, as well as some prevention tips if you are interested in reducing your own risk of type 2 diabetes. From there, we'll also touch base about prevention efforts in Canada and how our program in particular will fit in with that. The first question is, what fraction of the Canadian population is predicted to have type 2 diabetes or pre-diabetes by this year, the year 2020? And so of the answers listed, just think in your head which one you would guess is the correct answer for each of these to follow. The first potential option is A, 1/4 of the population, B, 1/3 of the population, C, half of the population, or D, 2/3 of the population. And so the answer here is actually B, 1/3. So 1/3 of the population is predicted to have type 2 diabetes or pre-diabetes by this year. The next question is, how many Canadians currently have pre-diabetes? Is it A, less than 3.7 million, B, 3.7 to 4.7 million Canadians, C, 4.7 to 5.7 million Canadians, or D, 5.7 million Canadians or more? So think again in your head which one you would guess. And surprising to me, the answer here is actually D. More than 5.7 million Canadians currently have prediabetes, which is quite a number of people across Canada. And then the third question, on average, what percent of people with prediabetes will go on to develop type 2 diabetes? Is it 25, 50, or 75%? Or do you really have no idea? So I thought the answer for this one is surprising as well. So 50% roughly of people with prediabetes will go on to develop type 2 diabetes, although this number is actually can go up even up to 70% of people. So quite a number. So these are some really interesting statistics. Just keep them in mind and the great percentages for them as we go along in our presentation today. Diabetes, type 2 diabetes itself is a large and growing problem that affects millions of Canadians. Over 1/3 of the population, as we mentioned in that quiz, will have type 2 diabetes or prediabetes by the year 2020, and more than 20 people are diagnosed with type 2 diabetes every hour of every day. However, diabetes itself is only the tip of the iceberg. So while 4.4 million Canadians are living with diabetes, more than 6.6 million are living with what's known as prediabetes. Prediabetes essentially occurs when before people get diabetes, where the amount of sugar in their bloodstream stays higher than it normally should, but not as high enough that we would consider it diabetes. By the year 2025, the number of people living with prediabetes is expected to rise even more, to be 6.9 million Canadians. Recent estimates predict that in the future, even as many as 70% of those with prediabetes will go on to develop type 2 diabetes. And the really challenging thing here is that people can live with prediabetes and even diabetes without knowing that they have it, because a lot of people don't show symptoms. So there's a lot of things that we don't know could even be happening. So knowing that the number of Canadians living with diabetes and prediabetes is rising, how exactly does this have an effect or impact on us? Well, diabetes has a lot of social, economic, and environmental impacts. So for example, diabetes puts a burden on our health as well as our healthcare system. For our health, diabetes can lead to a variety of expensive and potentially life-threatening complications, or basically problems that when diabetes left unmanaged or untreated can cause a lot of issues over time. So for example, things like heart disease, stroke, kidney failure, blindness, nerve damage, infections, and amputations are all serious complications that can occur when your sugars are high for a long period of time. There's also added mental stress, for example, from accepting a new diagnosis, maybe talking to friends and family, and managing all the different recommendations that are involved. Those with diabetes also spend a lot more time on medical visits, perhaps going to see their family doctor, maybe seeing specialists like an endocrinologist or a diabetes educator, or in serious cases, even going to the hospital. The Public Health Agency of Canada estimates that at least $2.5 billion is spent each year on diabetic care. And that's not including all the costs that are associated with treating those complications. So you can see both for our health and our healthcare system, there's a lot of expenses or costs as a result of diabetes. The good news is research does show that lifestyle changes can actually help to prevent or delay the onset of type 2 diabetes in those who have prediabetes. For example, eating well, like having a healthy meal plan, physical activity, and stress management can all be important prevention steps. So if you're interested in reducing your risk, here's just a snapshot of some of the quick tips to get you started. For example, with eating well, one thing that we can look at is the distribution or balance on our plates at different meals. So for example, if you don't already, consider filling half of your plate with vegetables. So anything from zucchini, broccoli, bell peppers, anything in season that you really enjoy, fresh, steamed, frozen, all of those you can have, aiming for at least 2 kinds for a half of your plate. The second thing to do is fill a quarter of your plate with a lean or vegetarian protein item. So for example, something like tofu, beans, lentils, chicken, or fish as that quarter of meat and alternatives. And then lastly, making your last quarter a low glycemic index carbohydrate. So basically something like potato, quinoa, whole grain rice, al dente pasta, some sort of grain or starch as that last quarter of your plate. In addition to balancing your plate, you also want to look at the portion size of each of those things listed. So one really great tool that you can actually use is just your hands as a visual cue. So for example, aim to have 1 to 1.5 fists of carbohydrates, so that grains and starches we mentioned at each meal, 2 handfuls, like a loose handful of vegetables, 1 palm size or deck of cards size for protein, and then a thumb of added fat to balance together on that healthy plate. In addition to looking at what and how much you eat, context I think should also matter. So take in mind to be mindful of where and what you're eating, maybe look at your hunger and fullness cues to make sure you're actually eating meals when you're hungry and stopping when you're full. Cooking more often or cooking at home can be another really great tip if you don't do this already. And it involves more so planning what you eat, involving your family and friends in meal preparation, shopping habits, all those sorts of things to make sure it's balanced and makes sense for everyone in your life. Also making sure to enjoy your food. We want you to still have those cultural and food traditions as part of healthy eating, but making sure you're still mindful of those nutrition recommendations we talked about. And finally, making sure to also eat meals with others, if possible, to incorporate some of that social aspect to the foods you eat. So that's a little snapshot to get you started in terms of eating well. We also look at activity as a great way to help reduce the risk of diabetes. So for example, beyond diabetes prevention itself, there's a lot of benefits to getting active. For example, reducing the risk of heart disease, perhaps increasing your metabolism, or basically how much energy you just burn naturally. It can also be beneficial for bone strength and bone density. So if you're someone who's concerned, for example, about bone health, osteoporosis, being active is a great way to protect for that. Weight loss and weight maintenance, improved sleep, improved energy, reduced mental concerns like depression or anxiety, and also for stress relief. So a lot of benefits that we can get from physical activity. What this might look like, according to the Canadian Physical Activity Guidelines, is a number of different types of exercises with different recommendations within each. For example, with cardio, or as we call it, aerobic physical activity, we're looking for a minimum of 150 minutes per week on different occasions throughout the week. This is including any activity basically that uses your large muscle groups, increases your heart rate a little bit, gets you sweating a little bit to be somewhat difficult to continue doing that exercise, and could include things like brisk walking, maybe biking, aquafit or swimming, any sort of those exercises that really gets your heart rate going. In addition, you may want to also look at strength training exercises, for example, 3 sessions per week, maybe doing 1 to 3 sets of 15 reps of the same motion. And you can do this in a variety of ways, maybe using body weights or small weights. Even I've seen people use cans of soup or bottles of water, or resistance or exercise bands as well. On the stretching side, we also want to encourage you to do things for balance and flexibility. So that might look like a yoga and Pilates, as well as making sure to do a proper warm up and cool down after any of the other exercises that you're doing. Beyond these structured routines, we also want you to think about how you can just build movement into your day outside of those regular exercises. So wherever possible, maybe to limit sitting time if you're constantly at a desk, and prioritizing activities that get you moving, that you enjoy the most, since the ones that you enjoy are more likely to be ones that you'll keep up in the long term. On the stress management side, since stress does also have an impact on how well you can put in place some of these different recommendations, and also has a direct impact on blood sugars as well, you may want to look at managing stress if you find you're having difficulties coping. So for example, just some small tips that you could do might look like identifying and addressing what exactly it is that's making you stress. What are the things that are creating the feelings that you're having? It could also look like making a to-do list, since writing it down and writing down a plan of when and what you're going to do it can make it a little bit easier to identify what you can do and when. In terms of realistic goals, people often have a general idea in mind of what they want to do, but it can really help to make it really specific, measurable, achievable, realistic, and timely. So basically starting with a small goal, something in particular you want to do right away to get closer to your big lofty goal, and then make sure to celebrate the successes as you go along. Another thing you can do is make sure you have a good support system. So find people who you can share your feelings with, be it your spouse, maybe a family member or friend, a support group or a hotline, anyone who can really support you and help you to deal with that stress together. Another great tip is to make time for yourself. So oftentimes we find people who really care for others or support others may put themselves last. So if you can even find 5 or 10 minutes per day to make some time to do something you enjoy that's just for you or for your health, that can be a really great way to promote it. Another tip would be to embrace humor, since laughter is shown to reduce stress and tension. So it could be even watching a comedy show or having a laugh with an old friend, but finding ways to really embrace humor and laugh more in your life. And finally, one great tip is to make a joy list. So basically writing down things that make you laugh, things that make you smile, and review it when you're feeling down or overwhelmed. So all of these tips together are really great ways to help you manage that stress. So I hope these tips help you a little bit to get you started, get you thinking about different ways that you can help reduce your risk in the meantime before you act on different ways. So next we're going to do a very quick true or false about prevention or diabetes prevention efforts in Canada. So the first question is, Canadians generally know about type 2 diabetes, prediabetes, and their associated risks. True or false? And the answer here is false, and we'll talk about why. The second question is, Canadians generally know or basically have been diagnosed if they have type 2 diabetes or prediabetes. And the answer here is actually also false. And thirdly, there isn't enough government and or private funding for diabetes. And the answer is false here as well. So what does this mini quiz tell you? Basically, the key message is that diabetes prevention in Canada is challenging for a variety of different reasons. Not everyone knows about diabetes, prediabetes, and the associated risks with having them. And as we mentioned before, someone may live with prediabetes for years without being diagnosed or really knowing anything about it. There's also limited funding, both from the government and private sector for prevention. And part of that reason is because there's so many people who go on to have diabetes, and we need funds to support their care and management once they do have it. As a healthcare provider, really there's only so much and so many resources at their disposal to deliver effective interventions for prevention. And so that might mean programs more as a community oriented programs focused on highest need, either through workshops or local programs. So that's kind of the circumstances surrounding diabetes prevention in Canada. So if we pause and recap here, we know that type 2 diabetes and the risk of it is increasing among Canadians, and this disease puts a major burden on individuals in the healthcare system. We also know that type 2 diabetes is preventable, and there's a lot that an individual can do to reduce their risk if they have the right supports. And so, as Brad mentioned at the beginning, that's where our Canadian Diabetes Prevention Program comes in. It's a publicly funded program by the Public Health Agency of Canada and other program partners that aims to help delay or prevent the start of type 2 diabetes in Canadians through no-cost 12-month personal coaching and online education materials. This program has taken multiple years of hard work and extensive research into the development and really creation of this program, making sure it is evidence-based. We looked at a lot of research in scientific journals as the basis for our design. And for example, the main model is a structured lifestyle management program run by the Center for Disease Control that basically looked at if this sort of program, the structured lifestyle intervention, would be effective. And this program's study found that participants at high risk of developing type 2 diabetes actually cut their future risk of developing it by 58% by attending this program. And even in the long term, 15 years after the fact that they took the program, they saw a continued or maintained risk reduction. So there's a long-term benefit as well associated with it. And this research is echoed by other countries, research in other countries as well, such as Finland, China, and Sweden. And so we know that there's an opportunity, and we're quite confident that this sort of program can work really well with the Canadian population as well. In terms of who can participate, there are two groups who are eligible. The first being those who are diagnosed with prediabetes by their doctor based on what we call an A1C or 3-month average blood test or a fasting blood sugar test, basically not eating or drinking anything a couple hours beforehand and then getting your blood sugars taken. The second group is those who are deemed at high risk based on a questionnaire that we call the CANRIS questionnaire. And you don't need to get this filled out on your own. We'll actually fill it out as part of the online screening for the program. So if anyone is interested in participating, really, they can go and see if they're eligible. In terms of what might make someone at higher risk and more likely to be eligible for the program, having multiple risk factors for prediabetes and diabetes will make this more likely. So for example, if someone is over the age of 45, living in a bigger body, certain ethnicities, at a greater waist circumference or blood pressure, have family history, having a generally diet that's a little bit poor or low in physical activity, all of these things can help make someone at higher risk and more likely to be eligible. As we mentioned before, this 12-month program does include a variety of different options or benefits. First of all, that one-on-one coaching session over 12 months with a health coach, as well as monthly workshops to reinforce what's covered individually. Between the coaching sessions, you'll also be provided online educational materials to complete and apply topics to everyday life, for example, on healthy eating, activity, risk reduction, and coping. And we'll also look at health tracking measurements for different areas such as activity, weight, waist circumference, and blood pressure. So participants will receive 22 or up to 22 coaching sessions over the course of the program. And one major advantage is that you don't actually need to travel anywhere like a clinic to participate. All you really need is a phone line and computer or smartphone with internet access to access the materials. Your coach has been one of the things people really like about the program because they can help you keep accountable, set and achieve realistic goals, and also provide you with accurate and relevant materials to help review and work on your own time. In terms of structure for this 22 sessions, for the first 3 months, we'll aim to have weekly sessions with your coach, followed by monthly sessions in the later 9 months of the program. If you're also interested in what sorts of topics we cover, here's a snapshot of a couple of them, generally just going over a comprehensive program in terms of exercise, nutrition, stress, and as well as diabetes prevention. On the health tracking side, we'll also look at using a variety of different trackers. You can also connect devices like a Fitbit. And we'll also make sure to do check-ins at every single visit, including your weight, your waist circumference, activity minutes, and motivation to really make it a really comprehensive and accountable program. We also will require you to do some assessments though at the beginning and middle and end of the program. And this is just to help us see if the program is effective at meeting its goals. In terms of what you can expect to see, so generally in terms of results for the program, the overall goal is to help prevent or delay type 2 diabetes by helping you make and sustain healthy habits. You may also experience some other results. So for example, weight maintenance or weight loss, a smaller waist size, improvements in your eating and activity levels, and also just being generally more knowledgeable about what the risks are and what you need to do to help reduce your risks personally. So if you are interested in participating in our program, or if you know someone who'd be a great fit, you can feel free to visit our website at lmc.ca/diabetes prevention, or I believe on Diabetes Canada, there'll also be a link there. And this website will provide you more details about the program, including the information from our presentation today. So if you are ready to see if you're eligible, there is a button in red that says, "Am I eligible?" And you can click that to fill out the CANRIS questionnaire that we mentioned and see if you meet the criteria and with next steps. So that's it for our presentation today. We will leave some time for question and answers. I saw some popping up through the Q&A, so feel free. Brad and I will be here to answer the questions in the meantime.
Yes, thank you so much, Jen. Yeah, so questions and answers. We do have a few already. If you haven't had a chance to ask a question, please press on the Q&A button. We'll do our best to answer your questions live right now. I'll read them out and we'll provide some answers. However, if we either run out of time or can provide more detail after, we will follow up with you on some answers to those questions as well. So the first question I have, and I have some answers ready to go as well already, is if you have been previously diagnosed with prediabetes, are you always considered to have prediabetes even if you don't go on to develop diabetes? So it's a great question. You would be considered to be in remission if you have already received a prediabetes diagnosis, but perhaps your blood levels reduce down to prediabetes levels. So you would still be considered to have prediabetes, but be in remission. I'll also share a bit more of a detailed answer with you following the webinar that Diabetes Canada has prepared as well. Then another question similar to the last. We hear a lot about people reversing diabetes. Is this true, or are they still diabetic but under control and can revert back? So similarly, you would still be considered to have diabetes if you've had a prior diagnosis, but your blood sugar levels reduce, but you would also be considered to be in remission. Curious to know about the major factors of influencing or determining the cost of diabetic medication being vastly different between Canada versus other countries. So I don't have a great answer for you now. Jen, Alex, unless you have some thoughts on that, we can probably share some information after the presentation.
Yeah, I think it depends. For example, with the states, it's a different funding model, different healthcare system. There's some restrictions in terms of the costs here to make it a lot more affordable or approachable in terms of diabetes medication. So it really depends on the healthcare system as well as what the companies want to charge in terms of those medications. But good question.
Great. Next question is, could one continue with a Weight Watchers program or similar and the CDPP at the same time? So that's a great question. Yes, you can. The program, the CDPP, covers a lot of helpful information about strategies to prevent diabetes. So it goes into quite a bit of detail. So as long as you're open to learning about those strategies, we would be happy to have you in the program, even if you're already on a Weight Watchers type program. Are you eligible if you already have type 2 diabetes? So unfortunately, the program is only for those with risk factors or with pre-diabetes. Unfortunately, those already with a diabetes diagnosis, whether it's type 1 or type 2 diabetes, are not eligible for the program. We can provide some self-guided material if you're interested as well, if you are not eligible for the program. Next question, so this is a very good question. Wanted to know about the rationale why someone who has a diagnosis of cancer in the last 5 years would be excluded from the study. It seems this program would be of great benefit to improve a person's overall health if they have been deemed to having pre-diabetes. So that's a really good question. So the CDPP is part of a research study. As such, it has a number of not only inclusion criteria, but exclusion criteria, or reasons why you could not participate. And these criteria are usually things that might affect the results of your participation in the program. So your ability to lose weight or to have your blood sugar levels change. Unfortunately, because of the study requirements, we are required to have a number of exclusion criteria. If you have any specific questions about each of those individual criteria, please feel free to email us at prevention@lmc.ca. Our email address is on the screen. And we can certainly determine if that criteria applies to you specifically. What should my A1C level be at? Jen, did we have a slide that mentioned the A1C levels specifically?
Yeah, I can provide it. So to be eligible for the program based on that prediabetes we mentioned, it would be an A1C of 6 to 6.4. And if you got that result recently, you can send in your lab results from your doctor to indicate that you're eligible.
Great. And an important reminder, even if your A1C measure is below that range, you still may be eligible for risk via having diabetes risk factors. So we encourage you to determine if you're eligible via those, which you can do through the link here and clicking on the Am I Eligible button, as you may be eligible even if your blood levels are not in the pre-diabetes range. What is the value of an endocrinologist? Jen, Alex?
Yeah, I think it's the value of any specialist who has a lot of training and is an expert in their field. An endocrinologist, not just for diabetes, but other hormone-based conditions, can provide a lot of specific insight and support. So if someone is deemed a value to have one, it may make sense to really support your care more specifically than with your family doctor.